Okay, calm down.
The first interview we're going to be playing is with two doctors who are currently in Gaza. And I recorded the interview with them on Friday, but right before this stream went live, I got some updates from them.
Just a quick update. Yesterday we were supposed to be out of Gaza, out of European hospital, but the border's closed. It's been closed since the incursion from Israel, and there's no safe corridor for us to leave right now. We definitely want us to go back to our responsibilities at home, but at the same time we want another team coming into the hospital with their supplies and their expertise and their willingness to help, especially because they would be fresh. So especially now as the UN worker was killed yesterday, there's a lot of extra precautions. We are now hearing the bombs more frequently and actually feeling the bombs more frequently. We are hearing the gunshots, which is something that is new for me. The gunshots from the tanks, the gunshots are very rapid and loud. It almost seems like they're encircling the hospital just at the same time. So there couldn't be a greater time for a ceasefire than now. The patients, I see gathering water. There's some water faucets that are specific that are sweet water, and the other water that is specific to salty water. Salty water is just the water that comes out of the faucet. It's always salty. It's tastes a little bit of salt, and there's separate faucets that have sweet water. But I'm seeing more people fill up their water jugs with that water and leaving the hospital. So I'm hoping that people outside are getting sufficient water. I'm worried about them. We here at the hospital, we're getting bottled water here. It used to be way more frequent. It used to be always around 2-3 cases. Now sometimes we go through a case and then we have to wait till the night till we get another case. But we're hoping that things end soon, hostilities end soon, for not just our safety but for the Palestinians here and for their safety. So we don't know exactly when we would be able to evacuate or really just exit Rafah and go back to our families and our responsibilities. But we're hoping for this to come soon. In the meantime, we're just working here as usual. We are doing the same work we've been doing, or even planning some, other lectures to give to students and other staff. So we're hoping for the best and continue to appreciate everyone's support in this, and especially with speaking to representatives, reaching out to your friends, and just talking about this issue. Appreciate it.
So obviously thinking a lot about these brave doctors and their brave patients and hoping I don't even want to say this, hoping they survive and thrive. Dr. Mohamad Abdelfattah, who is a critical care pulmonologist. He's Palestinian and lives in Orange County, California. We're also joined by Dr. Mahmoud Sabha, who is a wound care specialist who lives in Dallas, Texas, is from Orange County, California, and is originally from Jordan. Welcome, Mahmoud and Mohamad.
Thank you.
You're joining us from Gaza, from Khan Yunis, from the European hospital. Tell us what made you go there in the first place and what you're seeing right now.
I have been witnessing this ongoing genocide in Gaza for the past 6-7 months, day in, day out, broadcasted live on my phone, all over social media. We have been trying to organize locally to bring an end to this genocide with various actions, calling our reps, visiting our reps, city council meetings, and and it did not put a halt to this. So I did put out a volunteer request early in the conflict to come out here and try to provide any assistance that I'm able to. And luckily, I was given an opportunity to come out here, and I came out here because I want to directly help um, with whatever I can do. It's just I just felt like I could not sit back and not take action or do what I could, and so that's why I came.
And what about you, Mahmoud?
I think that sorry, the electricity just went out. I think that I came because I had a skill set that I think may be useful. I wasn't sure if it was going to be useful, but I was having a tough time just staying at home and watching what was going on and not at least trying to use my skill set that I've been trained to do. So I came to help, try to help as best that I know best. I'm a wound care physician. I've been training wound care, and I've been doing that since 2020. So and it's one of my passions actually. I love wound care, and the other thing is that I just um, I try to be as I'm a family physician, so it's kind of a more of a comprehensive type of field, a little bit of everything, and so when I do some wound care, I also try to look at all aspects of the patient and go from there.
How did you even get to where you are right now?
My friend Muhammad, he was the one that actually told me about him going with PAMA, Palestinian American Medical Association. I knew about PAMA, and I was able to. And he asked his the one who got him on, the coordinator, if they need a wound care physician, and so they reached out to me and asked me to come as well. So that's how I came to Gaza. And then at the same time, I also signed up for another mission, which was like a few weeks earlier than that. So this is actually my second time in a month.
And what is the journey like to get there?
Before the journey, what you have to do is like pack a lot of your own things and try to use. I knew that I would have to use my own supplies during the whole time. So for a few weeks beforehand, I was gathering certain things. My wife was doing a lot of work and also helping coordinate donations to people that want to donate supplies. I packed a lot of things, and you travel to Cairo. You stay there a night. You try to go to a WHO security meeting the day before. And then off you go, like at 4 in the morning towards Rafah, the border, and there's like a few checkpoints on the way. Some of them take longer than others, but and then eventually you reach the checkpoint. If you leave at 4 a.m., you get there around 2 p.m. because you have to wait at each checkpoint, especially around the Suez Canal. There's a lot of security there, and it just takes like another 4 or 5 hours just to cross the border. And then once you cross the border, takes another hour or two just to wait for clearance from the Israeli side, and then it's only a 10-minute drive to the hospital.
And what are you seeing right now at the both at the hospital, but also in Gaza in general?
Yeah, it's the dorms that are kind of across. It's across the street. It's in the same complex, but it's just across the street. It's the nursing college right here. So they've been kind of converted into like the regular physicians. Like across in the regular floor, we see the plastic surgery. He's living here with his whole family. So we've only been living this kind of um, college dorm life. It's just for a few weeks, but they've been living here with their whole families this whole time, like meaning 2 bathrooms per 50 people or something like that. And then also on the side, 2 bathrooms per like 30, 40 people. So that's how they're living. And that's how we've been living for the past few weeks.
What about your patients? What are you seeing?
So I'm wound care. So I see burn patients, and I do some inpatient and some outpatient. The outpatient, I see people that have had amputations, and here in Gaza, because of a lot of the sterility issues, things just can't stay clean, and a lot of the movement issues, meaning like nutrition, and just a lot of the wounds don't heal very well at all. So surgeons don't typically like to close the wounds after they've had to do an amputation or if they had to do an external fixation for broken bones. So, which is the correct thing to do, but that leaves us with a lot of work in trying to keep the wound clean and free of infection because these patients can easily become very sick, septic, meaning they can have bacteria go inside their blood and be a disaster after that.
And die, right?
Yeah. So once you have sepsis, I mean, there's a lot of criteria that it's out of my hands now. After that, it goes to the ICU usually. But it's basically you have to give them you have to use a lot of resources, fluids, and antibiotics. You have to have a lot of monitors, and it takes up a lot of manpower as well. So it's a lot of things that unfortunately are not readily available here in Gaza, especially when it comes to manpower. Because these nurses as well, they have families that are gone. They have families that they're also worried about. And most recently, in the past week, they just can't get to the hospital. I don't know
And
if you
why is
heard of a
that?
bomb that went off right now. Because of the bombs, that go off constantly, and the roads are blocked. They have just happen to live in a green zone or a red zone, and so that's it. I mean, it's very sad. They just can't come to the hospital.
Is there anesthesia that is available right now?
I brought some of my own Xylocaine for the plastic surgeons. I just happened someone that happened to donate some for me, so I brought some of my own Xylocaine, which is just anesthesia, local anesthetic that they and I think he's been using it ever since I brought it. I know I don't usually use it. I use it, rarely in the outpatient setting, just for local anesthesia. Like maybe only 10% of my patients, but these plastic surgeons they use it all the time, so they were happy to get that.
Israel has ordered people to evacuate to Rafah, obviously. This sounds like a victim blaming question, but can you explain to people why there are people who are not yet in Rafah?
What I know is what I'm seeing here on the ground. What I'm seeing on the ground is that people just can't get up and leave. Is because of multiple different reasons. Either their families are sick, or they don't have any security when they come here. Along with all the things that go on, there's a lot of scarcity and there's a lot of fear and there's a lot of lawlessness. So they can't just. It's not very easy just to get up and move and go around wherever you want. There's also fear just to even get on the roads. There's a fear to even to be shot at while you're just trying to transport your own things. And once you get to Rafah, I mean, I really don't know where they would go. The patients that were here in Rafah, they are actually being transported over now to Khan Yunis. So then they're with kind of coordination with the Red Cross. This is what I hear. I mean, I haven't actually read any articles on this. So from what I hear on the ground, people have been transferring over to Khan Yunis, and what I see is that the hospital when I first came in, I think 9 days ago now, um, still full of patients, still a lot of tents. When I say tents, it's just like a bed sheet basically, and that's all they have to cover from their whole home. So they've been clearing all that out, and so the hospital is a lot less full than it used to be, and they're going to Khan Yunis, so they're being really kind of just shuffled around. So there's a lot of factors. Everybody has different things in play. I have patients that have family up north, they have family even south from here, and they have family, and these are all in immediate family. It's just somehow they just get trapped there and they can't go anywhere else.
And what are some of the most disturbing, scariest things that you've seen that you feel like people should know about? And then what are some of the most inspiring things that you want people to know about?
Some of the most scary things I've seen actually in the last 2 days, because the patients themselves um, are asking me, where do I go? And I mean, they're like, I've heard of this hospital. Can this hospital, does this hospital have the same capabilities as what you can do? Are they able to do my wound care there at this hospital if I go there? And I have no idea. And not just that, I don't even know how they would get there. And I just don't know. And they're scared because they they know very well what happened at the other hospitals, Shifa and Nasser hospitals. And they're very scared that they will their families are now they're having to evacuate over to Khan Yunis. They're only letting one family member with the sick, so the rest of the family have to evacuate to Khan Yunis. And when they're saying bye to their family, their own families, it's as if they're saying a final goodbye. So it's very scary. Since I first came, it's probably the worst amount of sense of fear that you can just kind of it's palpable. But the most inspiring things is that there's still people coming here to work, and the staff, and and even more inspiring than that, if you can imagine something more inspiring than that, is some of the patients. There's even some kids are very inspiring. They can talk to you as if they have a lot of wisdom. They're patient, and um, and they still have faith. For me, I mean that's still very inspiring, and you can tell they have faith. Sometimes these people are under constant sedation, and when they're under constant sedation, sometimes they still are able to talk, and their inner selves come out, and you can hear what they're saying. It's like some people are just calling out to God, or some people are just um, asking about their loved ones, things like that. And so these are our patients. I think are the most inspiring, and I think I'm learning more from them than I am able to help them.
Mohammed, I just asked Mahmoud what the scariest, most disturbing things he's seen are, and then what the most inspiring things that he's seen are. So I just ask you the same question.
And I would say the scariest thing has been the amount of children injuries and deaths that I've witnessed in 9 days. I'm an adult ICU physician, so I'm used to treating adults. Here in the ICU, there's a mix of patients. You have an adult patient next to a child. And so, I've had to treat severe burns in the ICU, 50, 60, 70% burns of total body, which, already has a high mortality, a high death chance. But here, with the depleted resources, the lack of staff, the lack of attention to these patients, they're not surviving, and so it's been really tough to see that. Even the amount of trauma that we're seeing in the ER, severe head trauma to young children. It's just the amount of children overall that are suffering in this genocide, in this war, is unfathomable. I don't understand it. I know that Israel does possess the most accurate weapons that exist on this planet, and it's hard for me to see children be the end result of these munitions, and to know that our country is the one supplying these weapons, that we are 100% complicit in this. Every American needs to understand that there are children being murdered every single day in Gaza with American-made weapons, and our country can stop this. Our president can stop this with one phone call, and he hasn't for 6 to 7 months, and that's been hard to accept. And it's honestly just eating at me, and so that's been the scariest thing. It's just seeing these children. Inspiring, and I think I heard Dr. Mahmoud mention it, is the staff. They keep coming back to work, despite how overworked they are, despite the lack of resources. It's so stressful here. It's chaotic. The hospital there's patients everywhere. 30,000 people are seeking refuge here. So as you walk through the hospital, you're having all kinds of people come up to you. Doctor, where do I go to get this test done? Doctor, can you look at my child's eye? Doctor, how do I get this medication? Doctor, how can you treat? Look at my leg. Like literally every step that we take in the hospital, someone is coming up to us and asking. And of course, I don't have I don't have many answers for them, so it's hard. And these people are so desperate. These people have gone through so much, but still, the doctors keep coming back. And just to tell the story real quick, I'm sorry I'm speaking too long, but there was a resident physician that I worked with in the ICU. He basically, in January, was on call 24-hour shift, and while he was on call, his home was bombed. His mother was killed, his father was killed, his brother was killed, his two nephews were killed. His brother was sleeping in his room when he was killed. and he didn't hear for 24 hours. He didn't get notice because he was in the hospital. So the tradition here is to bury them right away. So all of his family members were buried without him being there. And so, you know, for me, I'm like, this guy got this news or missed these events because he was in the hospital. How does he keep coming back every single day? And so it's just, I mean, everyone has a story. Everybody has a story here in Gaza. This has affected every single person.
And were you and are you still scared for your own safety? Given the violence, the bombings, and also the fact that we know that doctors are being targeted. I mean, we just found out that Dr. Adnan al-Bursh was tortured to death.
When you're in the hospital, you don't really have a good, you don't have an understanding of what's happening outside. You don't see the reality. You're just seeing patients. You are seeing the effects. You're seeing the trauma patients come through in the ER, but it's just, it's work. So it's kind of hard to understand what's happening outside. I'm getting messages from family, friends concerned, like, why are you still there?
And where is your family from originally?
So my background is I'm Palestinian. We're from the West Bank, outside of Nablus. But I grew up in Southern California, and that's where most of my family is. I still have family in Palestine, in the West Bank. The West Bank is also under a different sort of aggression. They are basically prisoners. There are checkpoints, military checkpoints to every entrance of the village that we live in. There are settlers who come down from the hilltops with armed weapons, randomly shooting at people, burning olive trees. It's constant fear for them. They never know what they're going to face. For them to make a simple trek to the store, they don't know what kind of violence they're going to face. There's no future. There's no hope for them. There's no jobs. Every day they're losing more and more of their land. Every day they're facing humiliation at checkpoints. They're being detained for hours under the hot sun. I remember when I was there in the summer, just waiting at a checkpoint for hours for no reason. They're just holding your IDs. So it's hard. I mean, I always think about them and feel guilty for them. Like we've been blessed to grow up in America, have a good life, not have many hardships. But every day that they live in the West Bank has some hardship, some difficulty, lack of movement. They can't freely travel. So yeah, it's a different sort of suffering. There's a military occupation there. There's an apartheid system there. It's different from Gaza, but we're all one people, and I've been told that many times here, over and over, that you're from Nablus. You're us. You're our people. You're our brother. We're in this together, and so people still feel united despite the separate locations of the West Bank and Gaza. And I'm happy that they understand that we also feel like we are experiencing this with them, and that we're here to support them with whatever we can.